Imagine your cat, usually so calm, right? And then suddenly their skin starts rippling, twitching. Their tail might whip around like crazy. Maybe they yowl or even start chasing their own tail, sometimes quite aggressively. It's pretty puzzling, honestly, even a bit frightening. This condition, Feline Hyperesthesia Syndrome, or FHS, often gets missed, sometimes for months. Lots of stress for everyone. So today, we're going to really get into this. What is it? Why does it happen? And importantly, how is it managed? Useful stuff for you, whether you're just a curious cat owner seeing maybe some odd behaviors or even a new vet student trying to get a handle on things.
That's a really key point you made about misdiagnosis. And hyperesthesia itself, it literally just means increased sensitivity. So for these cats, it's an exaggerated reaction. It could be to touch, often along the lower back, or even just, air currents. Sometimes there's no clear trigger at all. And it's so important to understand these aren't behaviors the cat is choosing to do. It's involuntary. They're experiencing something real.
Okay, involuntary. So what do these episodes actually, look like when they happen?
Right. So typically you see these sudden bursts, these episodes. They usually last maybe 20 to 30 seconds, sometimes longer. And during that time, you get that classic skin rippling you mentioned. Often their pupils get really wide, big, and dark. You might see sudden jumping or frantic running around, maybe lots of meowing, or they could intensely lick or bite at their lower back, their sides, or their tail. In really severe cases, they can actually injure themselves, especially their tail.
Wow. Yeah, imagine how disorienting that must feel for the cat. Like this intense feeling they just can't stop.
Exactly. It's like an uncontrollable urge or sensation hitting them.
Okay, so if they can't control it, what's actually causing FHS? Is there one single thing responsible, or is it more complicated?
That's the million-dollar question, really. And what's fascinating, or maybe frustrating, is that the exact cause isn't fully nailed down. But we have several strong theories. Many think it's probably multifactorial, a mix of things. So one idea is that it's a maladaptive pain disorder. The nerves get hypersensitive, kind of stuck on misfiring pain signals, even if there's no current injury. So the cat feels pain, even without an obvious reason for it right then.
Like phantom pain, almost.
Sort of, yeah, that kind of nerve pathway dysfunction. Another thought is maybe it's a form of obsessive-compulsive disorder, an OCD-like thing.
Huh. How so?
Well, it could be triggered by conflict or stress, leading to compulsive behaviors like that intense grooming or chasing, like how stress can trigger repetitive habits in people.
Right, okay, I see that.
And then there's a neurological angle. It might be a type of seizure disorder.
The seizure?
Maybe. Some cats actually respond well to anti-seizure medications, which suggests there could be abnormal electrical activity in the brain involved, kind of like a partial seizure.
Wow. So it could be nerve pain, compulsive behavior, or seizure activity. That's quite a range. Shows how linked the mind and body are, I guess.
Absolutely.
Are some cats more likely to get this than others?
It seems so. While, any cat can develop FHS, we tend to see it more often in younger cats, usually between 1 and 5 years old. And there might be a genetic link, too. Certain breeds pop up more frequently. Abyssinians, Burmese, Persians, Siamese cats seem to have a higher predisposition.
Okay, interesting. And you mentioned triggers earlier, things like touch or air currents. But I read something really intriguing about scents. Can smells trigger episodes?
Yes, that's a newer area of focus, but definitely relevant. There have been case reports, fairly recently actually, highlighting that strong scents can be triggers for some sensitive cats. Things like scented candles, air fresheners, cigarette smoke, even strong cooking spices.
Seriously, cooking spices, wow.
Yeah. And beyond smells, definitely environmental and emotional factors are huge. Things like frustration, anxiety, big changes in the routine. These can all lower the threshold and make episodes more likely.
Gotcha. So, okay, if you're seeing these signs at home, what's the process? How does a vet figure out if it's really FHS?
Diagnosis is mainly about ruling other things out because the signs can overlap with other conditions. So your vet will do a really thorough exam, physical, neurological, look at the skin. They'll probably run tests to check for things like skin allergies, fleas, or other parasites, maybe spinal pain or other nerve issues that could cause similar twitching or sensitivity.
Rule out the more common stuff first.
Exactly. And something really helpful you can do is take a video of your cat during an episode.
Oh, good tip.
Yeah, showing that video to the vet can be incredibly useful for them to actually see the specific behaviors and help nail down the diagnosis.
Right. So once it is diagnosed as FHS, what can be done? How do we help these poor twitchy cats feel better?
Management needs a multi-pronged approach, really tailored to the individual cat. It's not one size fits all. A big part is reducing stress in their environment. That means providing safe, quiet hiding spots, keeping feeding times and playtime consistent. Routine is key. In homes with multiple cats, making sure there are enough resources, food bowls, water, litter boxes, scratching posts to avoid conflict.
Makes sense. Minimize the triggers.
Precisely. And environmental enrichment helps too. Things like puzzle feeders, climbing trees, interactive toys. Keeping their minds engaged can reduce anxiety and frustration. Then there's medication. Sometimes drugs like gabapentin are used. It helps with nerve pain, but also has some anti-anxiety effects. Or anti-anxiety meds like fluoxetine, Prozac might be prescribed to help manage compulsive behaviors or general anxiety.
So it's about managing the environment and potentially using medication.
Yes. The main goal is always to reduce how often the episodes happen, make them less severe when they do occur, and crucially, prevent that self-injury. Improve their quality of life overall. And one really vital point, never punish the cat for these episodes. They have absolutely no control over it. Punishment will only increase their stress and likely make things worse. Actually, an overlooked insight is how much predictability helps. Even small, reliable daily routines can significantly lower anxiety for these sensitive cats.
That's such good advice. This whole thing has been, really illuminating. It's such a perplexing condition, isn't it? Really shows just how complex our cats are and how much we're still learning.
Absolutely. And understanding FHS helps us shift perspective, What looks like just weird or bad behavior, it might actually be a sign of real distress or discomfort. It just highlights how important it is to really observe our pets and get professional help when something seems off.
Definitely. So for you listening, whether you're that concerned pet parent or a student tackling these cases, hopefully this gives you a better handle on FHS and how to support these cats.
And please do remember, what we've talked about today is for educational insight. It's not a substitute for professional veterinary advice. If you suspect your cat might have Feline Hyperesthesia Syndrome, or really any health issue, the absolute best step is to consult with your veterinarian for an accurate diagnosis and a proper treatment plan just for your cat.
So true. Always worth thinking. What might your cat be trying to tell you, even through their most baffling behaviors? Keep watching, keep learning, and definitely keep asking those questions.